Good afternoon, everyone. My name is Carmen Royal, Vice President of Communications for the Steve Fund. Thank you so much for joining us today. The Steve Fund is a leading nonprofit organization dedicated exclusively to promoting the mental health and emotional well-being of young people, especially those from underserved and under-resourced backgrounds. Our focus includes the period of adolescence and their life transitions beyond high school and into college and through into the workforce. We do so through research, partnerships, and culturally responsive programming tailored to each of our audiences. I'm excited to welcome you today to Centering Mental Health for Students in Higher Education based on our research that was conducted in partnership with the Lumina Foundation. Today, we are joined by Dr. Jasmine Haywood, the Strategy Director of Credentials of Value at Lumina Foundation. I'm pleased to thank the Lumina Foundation, which is a private foundation committed to making opportunities for post-secondary learning and beyond high school available to all. Dr. Haywood, thank you so much for joining us today. I invite you to provide your remarks. Thank you.
Thanks, Carmen, and good afternoon, everyone. Thanks for being here with us this afternoon or evening, wherever you are in the country. We're excited to have you. Feel free to drop your title and where you work in the chat or what institution you're at to start some conversation in the chat. Like Carmen said, my name is Jasmine. I am a strategy director at Lumina Foundation, and I'm happy to be here with you all today. I want to thank the Steve Fund for their leadership and partnership, and for our speakers today for bringing their expertise and their commitment to this important topic. Today's focus, centering mental health for students in higher education, is not only timely, but it is fundamental. This Harris Poll study, conducted in partnership with the Steve Fund and funded by Lumina Foundation, offers critical insights into students' lived experiences. The findings are clear. While students are more willing to seek help, they continue to face serious stress and mental health challenges that demand action from all of us. At Lumina, we believe that both well-being and learning are inseparable. Institutions cannot meet their mission if mental health barriers keep students from persisting and completing their education. Behind every data point is a student whose potential is at stake. That's why we invest in studies like these. Our new 2040 goal, which we unveiled earlier this year, envisions a nation where 75% of working adults have a credential of value. Achieving that vision requires us to recognize mental health as a core part of student success. If students are not emotionally well, they cannot reach their full educational potential. And then our communities and our workforce cannot thrive. My hope for today is that today's conversation deepens our understanding and motivates us to act, because no student should have to choose between protecting their mental health and pursuing their education. So thank you all in advance. And I am now going to pass it over to Dr. Prim, who will be sharing with you all a little bit more about the study.
Thank you, Dr. Haywood, for your introduction. And good day, everyone. Again, my name is Dr. Anel Prim, and I serve as the Senior Medical Director at the Steve Fund. I'm very pleased to speak with you today about some of the research that we've been doing at the Steve Fund. But before doing so, I would like to share a few points about the Steve Fund and the work that we're doing. First of all, we are in a mental health crisis as it relates to our youth. And we're really entering a critical moment for youth and mental health. With youth mental health in the United States being at a breaking point, with over 37 million young people at risk due to some of the proposed Medicaid rollbacks and even some of the CHIP rollbacks. For youth from under-resourced and underserved communities, this crisis is especially grave. It's compounded by layers of challenges, including economic instability, discrimination, cultural stigma, and generational trauma. And instead of narrowing some of the gaps, the disparities in mental health outcomes between students from underserved communities and others, they are actually widening. And this leaves millions without reliable pathways to care. The Steve Fund is responding with urgency, innovation, and community leadership. And I'd like to share with you our mission, which is to promote mental health and well-being for all youth, especially youth from under-resourced and underserved communities. And in addition, to equip youth, families, educators, and care providers with the knowledge, skills, and community support they need to promote mental health and well-being for young people. And we aim to strengthen protective factors for young people by transforming environments. And this is very important for the institutions that support youth and for them to adopt policies that support youth mental health and well-being, providing direct resources so that youth and families can access tools that are culturally appropriate, culturally responsive, and also to shape the field. And we do this by engaging with leaders, policymakers, and the media in order for us to leverage our expertise as well as our research. And so with that, I would now like to talk about some of the research that the Steve Fund has been doing. In this case, our Student Mental Health on Campus survey in collaboration with Harris Poll. So the purpose of this survey was to understand some of the mental health challenges that college students face as they navigate campus life each school year. This particular survey was conducted online in early 2024, between February and April, among just over 2,000 U.S. residents ages 18 to 24 years old, and in which there were 500 each Black, Asian, Hispanic, and white students, and 50 Indigenous students included in the survey. All students were attending a four-year college or university in the United States, and most of them were attending in person. These are the four areas of focus that the survey addressed: campus climate, perceptions and experiences, mental health and emotional well-being, mental health supports on and off campus, and student suggestions for improvement and new services. And so I will share some highlights from each of these areas. So regarding campus climate and perceptions and experiences, we see that there's a range of students in terms of percentages, from 57% among Black students to 40% among white students, who say at times they do not feel welcome in the spaces that they occupy on campus. In addition, there was a similar range of percentages among students saying that at least some of the time they feel that their success is not deserved or legitimate. And some of you may be familiar with this concept as imposter phenomenon. And certainly this has an impact on mental health. Other examples of perceptions and experiences on campus, there's a range of percentages from a high of 54% among Black students to a low of 43% among Indigenous students who say that they feel pressure to represent their entire race. And then from 40% to 53% of students across different racial groups have feelings of exclusion because of their differences, at least some of the time. And certainly this is not a recipe for mental health and well-being. Other perceptions and experiences include some negative ones, such as threats of physical violence, cyberbullying, and being stopped by campus police and security. And there are actually some rather alarming levels of these experiences among students, as we see in the category of discrimination, racial comments, and cyberbullying, where there's a range between a low of 29% up to 63%, even in the racial comment area. But the fact that in a majority of cases in these various racial groups, that up to 63% of students, close to 2 out of 3 having these experiences is very concerning. Other perceptions and experiences on campus include this highlight that the majority of all students witnessed discrimination in the past year. And within this, Black and Asian students had the highest percentages of witnessing at 65%. And then we found that 49% of Black, 39% of Hispanic, 34% of Asian, and 39% of Indigenous, and 31% of white students have considered dropping out of school due to their negative experiences. This is particularly worrying because at the Steve Fund, our goal is to help students in their academic achievement and developing and flourishing, and for them to drop out of school as a consequence of negative experiences is of great concern. The sources of their negative experiences on campus, the most common source was other students, and this was identified by 2 out of 3 students. And in addition, students identified faculty as a source of negative experiences at a much lower level, between 14 to 25%. And other sources of negative experiences, whether it be college staff, administration, or resident assistants, were mentioned less frequently. Being the only student of color was a really isolating experience for relatively high percentages of students, ranging from 36% of Indigenous students up to 58% of Black students. And the percentage of students across the board who said that they do not feel supported by their school range from 40 to 55%. And so these are real challenges affecting mental health that are experienced by students of all backgrounds. Let's move now to mental health and emotional well-being, in which we find that nearly 2 in 5 Hispanic, Black, and white students and fewer Indigenous students say they are currently very or extremely stressed about maintaining their mental health and emotional well-being at college. And just over half of all students currently rated their mental health as fair, poor, or terrible. And at least 1 in 4 students say that their college experiences have had an overall negative impact on their mental health. Well, what about mental health supports? We find that the top 3 sources of mental health support for all students were friends, parents, and siblings. And this was very important for us at the Steve Fund to recognize that peers as well as family members are important sources of support. That support might be informal, but it is support nonetheless, and is a pathway for young people to get the mental health services that they need, especially if we equip peers and families with the necessary information. Other sources of support, mentors, peers, and mental health professionals not associated with the college or university. And students identified some of their top mental health resources that they wish their college or university would offer, but does not currently. And these include psychoeducational programs, green spaces, safe spaces, urgent crisis services, on-call support, technology-based support, task forces developing procedures, guidelines, responding to students' needs, and mindfulness, meditation courses in quiet zones on campus. These things might surprise you, but they apparently are helpful to students. Students also suggested services such as increasing the number of counseling centers, offering student support groups, creating opportunities for students to discuss concerns and current events, and providing increased funding for clubs, events sponsored by different student groups, and also offering more academic counseling. Nearly 80% of students, all students, agree that colleges and universities need approaches tailored by ethnicity and nationality to help support their unique mental health needs. And, at this particular time, it may be difficult to achieve this desire for students given the dismantling of some of the diversity, equity, and inclusion infrastructure on campuses. But hopefully, other divisions of universities can embed resources and supports that can help students in this way. And also, approximately 4 in 5 students agree that colleges need to direct more resources to help students manage their mental health. So, what is the Steve Fund doing to respond to student needs? Certainly, transforming environments through the Steve Fund's consultation service and our Excellence in Mental Health on Campus initiative is one way to do that. Also, delivering programs and resources, including educational webinars, workshops, toolkits for student, faculty, and families, in-person conferences, and our well-being and color peer co-led support groups. Also through our thought leadership and field building through our research, such as what I just described, and others that we've conducted with the Child Mind Institute on Black families and Black young adults, and also with United Negro College Fund and the Healthy Minds Network on HBCU college student mental health. What can students do? They can find out what campus resources are available to support their mental health and well-being. They can develop protective factors such as support systems of their friends, families, and classmates, resident advisors, counselors, faculty, staff, faith leaders, coaches, etc. And also to identify off-campus and online resources that could support their mental health and well-being, as well as cultural grounding. These are some other things students can do. They can access the Steve Fund's My Safe Space campaign for the mental health of underserved people. And here's a QR code that can bring you to that space. This helps to young people to access safe spaces for what we're calling soul care, a rather innovative approach that's not so much the medical model, but really tapping into other things like love and justice and hope, which are all very important. What else can faculty or what can faculty and staff do rather? Familiarize themselves with the mental health concerns that students commonly experience by attending Steve Fund workshops and webinars, providing information and course syllabi about mental health and resources on campus, and also being flexible with course assignment deadlines whenever possible when students are struggling. Faculty and staff can also engage with the Excellence in Mental Health on Campus initiative, which I described earlier, which is a way in which campuses can be supported in really transforming their campuses to be more conducive to the mental health of students, and in particular students of underserved and under-resourced backgrounds. utilizing the Steve Fund's campus coaches, our needs assessment, our action planning, and creating community, a learning community with other colleges and universities around the country who participate in this initiative. So what can families do? Families can familiarize themselves with the mental health concerns that college students commonly experience through the Steve Fund's workshops and seminars, and also by finding out about available campus mental health and crisis resources for their child. Staying in touch with their child, their student, offering encouragement and unconditional love. These are critical protective factors for mental health and very important aspects of support systems. Our family initiative has numerous resources. We're helping to mobilize parents and caregivers to nurture and protect their young person's mental health by protecting, nurturing, and thriving. And also, our new Family Corner site offers toolkits with articles, guides, and other resources that can support families in caring for the mental health of their young people. Hopefully, you will access these wonderful resources, our monthly newsletters with culturally responsive articles, our toolkits and journals that you may find helpful in navigating this transition from adolescence to young adulthood, where mental health is so important. And I will stop there. Thank you very much for your attention. And I would now like to turn things over to our moderator, Dr. Byron Cliff Breland, who is also chair of the board of the Steve Fund. Dr. Cliff Breland, over to you.
Thank you. Thank you so much, Dr. Prim. Thank you so much for getting into the numbers and really setting the table for our discussion this evening. As mentioned, my name is Dr. Byron Cliff Breland. I've had the privilege of serving as the chair of the Steve Fund Board, for which I've also been a longtime board member, where I've had the opportunity to work alongside so many dedicated leaders who are committed to advancing the mental health and emotional well-being of young people of color across this nation. I'm also serving as the chancellor of the North Orange County Community College District here in California. This afternoon or evening, depending on where you are, we gather not simply to discuss numbers on a page, but to confront the lived realities behind those numbers, the anxieties, the burdens, the courage of our students. The Harris Poll, in partnership with the Steve Fund, tells us that more than half of college students rate their mental health as fair, poor, or terrible. For diverse students, such as our Black, Asian, Indigenous, and Hispanic students, these burdens are compounded by the feeling of being unwelcome, of being seen as other, or carrying the weight of representation on their shoulders. James Baldwin once reminded us that not everything that is faced can be changed, but nothing can be changed until it is faced. And that is exactly what we're doing here in this moment. We are facing it. We're acknowledging that students are not abstractions, they are flesh and blood, searching for belonging in institutions that too often mistake inclusion for excellence and equity, and visibility for support. So before we begin, let me offer gratitude to the Steve Fund for its tireless work over the past decade, to our partners at Harris Poll for helping us see the truth of students' experiences, to Lumina Foundation for its steadfast commitment, and to Dr. Anel Prim, whose presentation this afternoon, again, grounds our conversation in both rigor and compassion. I also want to thank our panelists, Dr. Carlota Ocampo, Dr. Batsi, and Jacqueline Lopez for bringing their wisdom, their professional insight, and their lived experience into this space. This afternoon's conversation is grounded by the thoughtful presentation from Dr. Prim, whose work lays to bear both the challenges and the opportunities before us. But let us be clear, this is not only a matter of data, this is a moral summons to transform our campuses and the places where every student feels valued, supported, and whole. So I want to say how grateful I am to share this space with our panelists and with all of you as we reflect on the findings and chart a course forward. Now I'm going to have the panelists introduce themselves, and I'm asking them to take about 45 seconds to a minute before we get into their opening reactions to the data that was presented. So I'm going to ask them one at a time, starting with Dr. Ocampo.
Greetings. Thank you so much. That was so inspiring, Dr. Cliff Breland. I'm Carlota Ocampo. I am the provost at Trinity Washington University in Washington, D.C. We are a PBI and an HSI and a women's college. So we call ourselves a diamond encrusted unicorn. There's only 3 institutions in the US with a similar profile. I'm steeped in mental health equity work, been doing it for a long time. I'm also on the board of the Steve Fund. And I'm absolutely thrilled to be here with some of the folks that I've collaborated with over many years.
Thank you, Dr. Ocampo. And now I'm going to ask Dr. Batsi if you can introduce yourself.
Yes, thanks. Hi, everyone. Thank you again for having me as part of the panel. And just really appreciating Dr. Prim's overview as we got started. So my name is Batsi Rayatunzabayev, but I go by Batsi. And I'm currently the Director of Integrated Care Initiatives at the University of Pennsylvania's Counseling Center. I'm trained as a counseling psychologist, and I have worked with the Steve Fund for approximately over 5 years now. And I attended an HBCU for my undergrad, so I tend to do some of the initiatives around some of that work. So again, excited to be here to share some perspectives.
So thank you, Dr. Batsi. And last but certainly not least, Ms. Jackie Lopez, if you can introduce yourself for everybody.
Hello, thank you for having me and thank you for the introduction. My name is Jacqueline Lopez and I am a second-year doctoral student in clinical psychology at the University of Nevada, Reno. I study how cultural values and family context shape the effectiveness of evidence-based interventions for children's behavioral and emotional challenges, with a focus on Latinos and immigrant families and caregivers. And my goal in the future is to advance culturally responsive, family-centered practices to make sure that systems such as schools, community centers, and hospitals better serve diverse communities. And I'm also a Youth Ambassador Board student member.
Thank you so much, Jackie. And with that, Jackie, I'm going to pose the first question to you as a part of our initial deep dive and reactions to the data that Dr. Prim presented. So over half of students rated their mental health as fair, poor, or terrible. What does this convey about campus culture and systemic support gaps in your opinion?
Yeah, that's a really good question. When I see over that half the students rate their mental health as fair, poor, or terrible, I don't think about the individual struggles, but I also think about the campus culture and the systems that are supposed to support us. This number tells me that even though services exist, students are still carrying a heavy load without feeling like they have the right outlets to let that out. Oftentimes, financial stress, discrimination, and the pressure to belong, as well as imposter syndrome, often goes unaddressed. And that also creates an environment where students feel isolated and overwhelmed in these university systems. And to me, this statistic shows that our institutions are not simply facing a student problem, but a cultural problem that requires rethinking how campuses prioritize mental health as a foundation for student success. And going back to that campus culture, as a first generation Latina graduate student now, but when I was in college at UC Santa Barbara, I worked during my 4 years of undergrad. And on top of that, balancing extracurriculars, exercise, studying, volunteer work, having a social life, and also taking care of myself. All of this adds up towards that campus culture. And without the right support systems, it's often difficult to navigate such a space without the support, let alone the right support.
Thank you so much, Jackie. And thank you for that personal insight and reflection as well as your professional experience with this matter. And I'm going to ask Dr. Batsi if you'd like to weigh in on that same question.
Yeah, I mean, I think echoing a lot of what Jackie shared, based off of the data that we just saw, we understand all of the different pressures that students are experiencing. And I think Jackie highlighted some additional barriers as well and challenges that students have. And I think one of the things that I take away from seeing that many of our students are rating their mental health as fair or poor is that as folks working in higher education, or if we have a loved one who is attending a higher education institution, we can't really opt out of the conversation around the importance of mental health because we understand that the need is high. So I think one of the things that it really highlights is it's a community effort. And I think that's what it says about the culture we're creating for our students, but we can't expect our students to be the ones to solve the problem. Like it has to be on all of us. It's on students to be proactive. It's on loved ones and family members to make sure again that we're being proactive and checking with the folks that are in those systems. And I think for faculty and staff, it's understanding the problem and making sure that we are making ourselves available and being proactive in making sure students are accessing the resources that are available, but also making sure that we are educating ourselves and watching some of our biases, watching some of the ways that we think about our students, and really just having a very strong love ethic and thinking about the work we need to do to support them.
Thank you so much, Dr. Batsi. And within these opening reactions to the data, I have one more question I'm going to pose to you, Dr. Ocampo, and that is around the whole notion of imposter phenomenon impact. And Dr. Prim mentioned that roughly 40% of students report imposter phenomenon. What ripple effects have you seen this have on student engagement, belonging, or help seeking?
Wow, absolutely. And yet these are the students that are going to drive us forward into the future. These same students who feel, like their success is undeserved. So I want to start by asking the audience, how many of us have experienced imposter phenomenon? You can just write in the chat, me, or, chime in. I think that probably very few of us have been untouched by the feeling that we somehow don't belong in spaces. And, imposter phenomenon, yes, there we go. All of us. Yes, exactly. Trouble fitting in all the time. Yes. So, imposter phenomenon used to be constructed as a syndrome, like something internal to us, and somehow it was like a mental health issue that was inside of us. It's not in the DSM-4, by the way. Imposter phenomenon, however, is something that's socially constructed, and it's constructed in our environments. That's why we started calling it a phenomenon. And it comes from the idea that somehow people who require access can't also be excellent. And I want to say access and excellence are not mutually exclusive. And, I repeat that all the time. Access and excellence are not mutually exclusive. Michelle Obama addressed this in her book, Becoming, where she said that she always felt like, when she got high in the, levels of government, there were going to be all these really smart people, and she was going to feel like she was admitted into these rooms where all these great decision making and policy making was going on. And then she got in these rooms and she said, oh my gosh, I am the smartest person in this room. And what we as administrators and faculty and staff need to help our students understand is you are the smartest person in this room. You are the smartest person in this room. Any room you walk into, you are the smartest person there. You have something to contribute. And I don't say that lightly. Now, what do we put in place here at my institution to help with that? There are many, many, many programs that we've put in place under a project that we call Inclusive Excellence, which is a curricular and pedagogical revolution in the way that we deliver materials to students from diverse backgrounds. But one of the initiatives I want to really focus in on is mentoring. I went to an HBCU, so even though I felt like an imposter a lot of the times, I saw excellent people of color around me going to the highest levels of achievement in their fields. And that's what we need to do for our students. So we created a curriculum where we took a 4-credit elective and we turned it into 4 1-credit mentoring courses that are actually embedded in the curriculum. A lot of times our students can't access mentoring outside of the classroom because they're too busy and they've got so much going on. And maybe, even getting to a class might be a mental health challenge, but when it's embedded in the curriculum, they're going to show up and they're going to get it. So being mentored by people who build the confidence in them, the kind of confidence that I'm talking about right now, that teach them how to be self-directed learners, that teach them how to understand that they have careers in that space, that teach them to build affiliation with careers in the space, that connect them to people who look like them, that have careers in the space. All of these things can really help our students understand that they're excellent. Now, by the time they get to be my age, they'll understand that. But that is a journey and a process, and it's really important that we put the supports in place to help them do that. I could go on and on, but I'll stop with that one initiative. But if you want to hear,
No, that was great. It leads right into the next one. You're talking about tailored support. So I'm going to pose this question to Jackie, and that is, with 3/4 of students, especially students of color, wanting to have tailored mental health resources, what does culturally responsive support genuinely look like at your campus or institution if it's not a mentoring program, such as what we just spoke about by Dr. Ocampo?
Yeah, to me, culturally responsive support means meeting students where they are, acknowledging that healing can look different across communities, and affirming the role of family and community as part of care. And when it comes to family, for me, that resonates very deeply because my first source when it comes to support, I often look towards my family, mentors, my best friend, not just professional services. And it's also really powerful to be surrounded by peers and mentors who actually understand our cultural backgrounds and the unique challenges we face. Even here on my own campus here at the University of Nevada, Reno, I've had the privilege of being both in California and in Nevada when it comes to school. I went to UC Santa Barbara for undergrad, and I'm here now in Nevada for graduate school. And I also see like the different types of like resources when it comes to like towards mental health. And here on my own campus, here at UNR, that looks different because oftentimes the discrepancies and the differences I see in California are not reflected here in Nevada. And when I think about culturally centered and responsive interventions, I think back to my experiences at UC Santa Barbara because I often felt like I found the most support there. I'm bilingual, so when it comes to mental health services, I often look towards people who understand my background, are bicultural, bilingual, and when I was at UC Santa Barbara during my sophomore year, I was trying to find support, mental health support, and I unfortunately had to go outside of my campus to participate in an IOP program. And I had the amazing opportunity to work with a bilingual, bicultural therapist and a dietitian who not only understood my background, but they understood why I was here and why I was looking for that support. And it wasn't until I was on the wait list at my university where I finally was able to get a Latina therapist on campus, but it took such a long time for me to get to that point that that's one of those discrepancies and issues that continues to exist within universities. And being at the university, it's also really helpful as a student because, like I mentioned earlier, I worked during undergrad. I had my classes on campus, student health was on campus, my research job was on campus. So just being able to have a space where I can easily go see my therapist, whether it be once a week, once every 2 weeks, or even once a month, like that was really helpful. And even when it comes to having those cultural systems in place at UC Santa Barbara, we had spaces for Latinos called El Centro, which was a space for first and Latinx students where we had a place that felt like home. And although there was talk about expansion towards that, I truly did appreciate that we did have that space. And looking at it now, like I recognize that at UC Santa Barbara, we had so many cultural centers like the American Indian and Indigenous Cultural Resource Center, the Asian Resource Center, Chicana Latinx Cultural Resource Center, and I come back now and I think about my institution now, and it's something that Nevada definitely is catching up on. But when it comes to culturally tailored mental health, that is something that I truly, in my work, I tend to be more of an advocate of. And even in the space here at the University of Nevada, Reno, I am still looking for resources related to that. And it's oftentimes because a lot of universities don't offer that.
Yeah, excellent. Thank you so much, Jackie. And I'm going to move us into the addressing disparities section. So this next question is going to be for you, Dr. Batsi. And it is, despite rising mental health concerns, many students, particularly at HBCUs and PBIs, underuse services. How can institutions dismantle barriers and build trust in under-resourced communities?
Yeah, I think a lot of what Jackie was actually highlighting sort of starts to answer that question. I think a big part of it is for many students, they don't always see the staff within a counseling center environment as reflecting not just their identities, but sometimes their values. So it becomes even more important how we message to our students, like what do we communicate to them? How do they know they're welcome? One of the things that'll come up with some of my students sometimes is they'll apologize for like taking my time. So after an appointment, they'll say, "Oh, I'm so sorry, I didn't mean to take your time." And every single time is being able to say to them, no, this is actually why I'm here. Like, I'm here to have these conversations with you. I'm here to make sure that you're getting the support you need. So for many of our students, those are some of the barriers that we have to try to dismantle, is that they're inconveniencing us, or their needs are too much for us, or for whatever reason that they don't belong, whether it's in our counseling center or on our campuses. So how do we make sure we're continuing to reinforce the idea that in the example that Jackie gave, even if we don't have a therapist that matches your identities or, matches exactly what you were hoping for, we may still have someone here that can understand where you're coming from, how you're feeling, even if they have never experienced it themselves. And making sure that that cultural humility, that understanding is promoted within our campus environment and within the counseling setting. The other thing I want to highlight to what Jackie was mentioning is the importance of the cultural resource centers or other offices like that on campus, in that if you are in a counseling center, it's so important that you're building those relationships, building those collaborative relationships with people across campus, because as you saw from some of the data that Dr. Prim presented, when students think about where to seek help, they may not think of us first. They're going to think about their family environments, their friends. So our role becomes so important because we have to be proactive in making sure that students start to think of us as well, that they don't feel like, oh, if I can't reach my friend back home, that means I have no resources, or that means there is no help for me here. But in fact, it's, yes, you can come into a counseling center, or we have something on our campus called Let's Talk, which I think is available on other institutions as well, where you can go talk to a therapist for 20 or 30 minutes at the library, right? And that's still also accessible to you. Or some of the resources that Dr. Prim covered that the Steve Fund offers, where you can go online and read some information and figure out some ways to support yourself as well. So I think those are all the different ways we can try to think about how to close that gap and making sure we're being very thoughtful about how to do that.
Well, thank you so much, Dr. Batsi. And our running theme here has been about, how do we integrate this structurally? And I'm going to turn to you now, Dr. Ocampo, and ask the next question. What frameworks, like the Excellence in Mental Health on Campus, EMHC, safe spaces or green spaces, are most effective in embedding mental health as a shared campus-wide commitment rather than siloed services?
Right. So I do recommend that everyone go to the Steve Fund's website and take a look at the Excellence in Mental Health Framework, because there's a number of recommendations there that, when followed, can help institutions really transform the way that they deliver mental health services. And I'm going to use the language historically excluded students, because we know that up until, I don't know, sometime in the mid-60s, there was not really protection to ensure that certain students had full access to being in higher education spaces. So historically excluded students often do come on campus without having the same kinds of frameworks of reference for the campus that other institutions might, that other students might. And I want to add to something that Dr. Abatzi said. I think in addition to inviting students into the counseling center, and Jackie said it as well, if we can embed mental health initiatives. So first of all, we have to promote mental health and well-being for historically, excluded students and all students as a campus-wide priority. And that means that it has to be generated from a framework of leadership, of trauma-informed leadership. So that means we have to train campus leaders to be trauma-informed and understand the importance of mental health and how to create environments that are safe. One way to do this, if students don't want to come in the counseling center, is to have different kinds of initiatives distributed throughout the campus. So one of the things that we do here, and I saw someone put in the chat that it's difficult to do affinity group kind of spaces now, but we can still do a variety of different kinds of spaces where all are welcome and invited, but may showcase particular cultural practices or sharing among students who unite around a particular theme and want to be together. And those can be spaces, that are not necessarily targeted towards being academically, building an academic strength, but that really are targeted towards students being able to form those connections with each other. And another thing I just wanted to say right quick, because I don't know if I'm going to have a chance to say this again. Another thing that I think is really important for many of our students today are some of our students are experiencing anger as a response to what's happening in the world. And, we tend to shy away from anger and not like it. And sometimes that can turn into depression when people internalize it. I think it's really important to help students find healthy outlets for their anger. And one way to do that is to help students engage in safely engage in activism. Activism, learn, and Dr. Batsi had put this in a chapter for a book that's going to be coming out pretty soon about equity and mental health. So I wanted to highlight it. You know, helping students learn how to channel their anger into some kind of proactive activism can really go a long way towards helping them burn off some of that steam that otherwise can turn into, mental health issues down the line. So with respect to excellence in mental health and the framework, there are many, many, many recommendations there. But a really key feature of it is transforming leadership on campuses to understand how to deliver trauma-informed services. I know that was a lot.
Thank you. No, thank you, Dr. Campo. There is a lot. We're motoring through this. I want to invite the audience in a couple of minutes. We will open it up for a general Q&A. I've got 2 more questions here for our panelists, and then we will field your questions in the chat as we are able to. Next question is really on engaging our partners and scaling support. So I'm going to ask Dr. Batsi this question. With strong demand for tailored supports, what types of advocacy can funders and policymakers pull through grants, policies, or metrics to catalyze culturally responsive mental health systems?
Yeah, absolutely. I mean, I think there's a few different things that come to mind. So one of the questions that I try to reflect on, and I think as we're working as a staff trying to think about is when we are creating programs, when we are thinking about changing our policies, what student do we have in mind? So an example of that is, as we're having discussions about a student going out on leave, right? Maybe they have to take a leave of absence for mental health reasons. And we may say, oh, the family can be support. But there's some situations where that's not the case. And in fact, them taking a leave of absence might actually have other negative impacts on their mental health. And of course, there may be questions of, maybe they can't stay on campus. How do we still support them? And of course, when resources are not as available, those questions become even more important. But when we think about it from a place of understanding the impact that it has on all of our students and not just maybe the ones that are well resourced or the ones that we sort of have in mind as having access to certain things, I think that could be something that can help us tailor our services better and really think about where our resources, whether that's money or people, where we can start to allocate some of those resources. So just being able to really ask ourselves as we're creating these things, who do we think is going to benefit the most from them? And sometimes the students who need them the most will not actually feel the benefit of some of the things that we're doing. So that's a thought that comes to me.
Thank you so much, Dr. Batsi. And I've got one last question I'm going to ask for Jackie. And that is, as we envision the future, if we're thinking about an aspirational outlook here, what would a mentally healthy, inclusive campus environment look like in 2030? Like that's so far away, a couple of years, but in 2030, especially for underserved and under-resourced students, what would that mentally healthy, inclusive campus environment look like in 2030?
That's such a good question. Oh my God. I feel like for me, when I envision a campus like that, by that year, I think about being able to have as much support as possible within, whether it be through student health, being able to have the appropriate amount of like counselors, clinicians, mental health professionals, but also seeing that reflected throughout the classrooms as well. I think about my journey coming into the PhD, and I had no idea what a PhD was until I saw representation in my classrooms and being able to have professors that not only advocated for students, but also demonstrated to us that showing support for your mental health matters and being able to navigate these systems, even if we were not made with them in mind, we are still able to accomplish them. And it's a difficult journey, especially being first gen. My parents never finished high school, let alone middle school. And so being in this space where I want to be able to envision a better future, not only for myself, but for the people that follow. I imagine an institution where I'm able to find culturally responsive spaces, I'm able to find support where people truly do understand where I'm coming from. But also, when it comes to support, that can be shown in different ways, whether it be through scholarships, through service, through mentors that can guide other students when it comes to higher education. I think about so many avenues that can kind of bring this to fruition, but what stands out to me the most is being able to have that type of support, whether it be through cultural centers, through counselors that can really hone in on our understanding and being able to see that through.
Excellent. Thank you so much, Jackie. Very, very well said. Now with that, I'm going to open this question up to all of our panelists. And that is, of course, we're looking forward to 2030. But if you could ask our higher ed leaders in the audience joining us here this evening to act on just one survey insight that they heard today, what would that be and why? That, our immediate action steps. What would that one thing be and why? And I'll ask maybe Dr. Ocampo first to weigh in on that.
You know, I have to say that one of the findings that really jumped out at me was the number of students who thought about dropping out of school as a result of their mental health. And I think the one thing I would say to administrators is to really pay attention to that, to really pay attention to the fact that students are leaving, students are what they call quietly quitting. There's students who will just quietly disappear from class and never be heard from again because their mental health is impacting their ability to really engage. So I just suggest that get in touch with all of the resources about how to transform campus environments to make sure that we're paying attention, not just to students' intellectual development, but also to making sure that they can be in mentally healthy spaces. That is something that they can learn how to do in college, and then they can carry those principles with them throughout their lives, just as they do the principles of knowledge and inquiry.
Thank you, Dr. Ocampo. How about you, Dr. Batsi? Any comments on that one thing that you would ask our audience members to take away from today's insight?
No, I mean, I think one of the things that comes to mind is when we think about staff and counseling centers or things like that, one of the first questions or concerns people bring is that we don't have enough financial resources to hire more people. And I think one of the things in the survey that really jumped out to me was the importance of green spaces and mindfulness and quiet spaces for students. And those are things that I think can be accessible because there's things that you can access online that are free. There are resources that, and I think that was one of the other recommendations, technology-based resources. Those are all things we can also encourage students to access. And the reason why those things feel important, not just because they're accessible from a financial perspective, but because I think our students are inundated with so much information, whether that's through their classes, through social media, through people in their lives, family, friends, all of those things. And being able to ask a student, what have you done for yourself, whether it's to take a pause or to just like have fun. Sometimes it's one of those things that can be sad to see when I say to a student, what was the last thing you did for fun or what do you plan to do for fun? And they kind of stop because for some reason in their busy schedule, they haven't booked time for that. They haven't thought about whether they're actually enjoying the things that they're doing. So again, just thinking about the benefit of green spaces, mindfulness, and just encouraging students to take time to take care of themselves and have those quiet moments, I think is one thing I would definitely recommend.
Excellent, thank you. And it sounds to me like I'm hearing that by expanding culturally responsive supports, involving families as partners, investing in peer-led models of trust, and by embedding mental health into the rhythms of campus life, if you would, we can create institutions where belonging is no longer aspirational, but expected. And at a time when we can reimagine campuses as places that do not simply admit students, but uplift them, protect their wholeness, and prepare them to thrive, not in spite of who they are, but because of who they are. And I think by employing these tactics, we can build more supportive campus experiences for all students and ensure that no one, especially those without ready access to care, is left without the mental health support that they need. And with that, I'm going to ask Jackie, is there anything that you want to weigh in on or any final thoughts or comments from you or any of the other panelists? But I'm going to throw it to you first, Jackie.
Just one of the things I wanted to emphasize, representation matters. I think when it comes to entering these higher spaces, And when it comes to seeing mental health professionals, seeing someone that is able to look like you, that is able to understand where you're coming from, and that is able to hear you in a space that's so individualistic truly does matter. And coming up in these higher education spaces, especially when it comes to research funding and when it comes to funding projects that are culturally and linguistically sensitive towards BIPOC populations. I've personally been affected by the funding cuts that have been occurring and have lost a mentor because of those cuts as well. And so I just want to be able to emphasize that whether it be through policy, advocacy, even research funding, that representation matters, and being able to bring in more people that look like me, that look like you, that are able to represent what diversity is truly important, especially in this day and time.
Thank you, Jack, and thank you for personalizing your experiences and sharing that with us. I really appreciate that, and I know many of our audience members appreciate it as well. We have some great comments coming in through the chat. Thank you all for your engagement. And any last minute, 20-second thoughts from our panelists before I close us out?
I have one, thank you. One of the Excellence in Mental Health Framework recommendations is engage students to provide guidance and feedback on matters of student mental health and emotional well-being. And I think if there's one takeaway for college administrators, this would actually be my one takeaway, that each campus is different and each set of students is different. So engage the students and find out what they need, and then try to give them what they need, and try to find the funding and resources to do it. I know it's challenging right now, but we got to get out there and roll up our sleeves, because this is the moment we've been training for.
Thank you.
The
Dr.
last thing I
Bhatti?
will just add is actually something Dr. Prim said in her presentation. I think so many of our students, and I think for those of us in higher education, we are in need of love, justice, and hope more than ever right now. So just wanting to reinforce what Dr. Prim said earlier.
Thank you. And thank you so much, Dr. Bhatti. And so as we close, I'm reminded that James Baldwin also wrote, "The place in which I'll fit will not exist until I make it." Our students should not have to make their own place alone. It is our duty as educators, funders, policymakers, families, to build that place with them. Again, Dr. Prim's presentation reminded us that nearly half of students have considered transferring or even dropping out because of mental health struggles. And yet, we also learned that help seeking is rising, stigma is shrinking at the same time, and students themselves are calling for more support groups, green spaces, safe spaces, and culturally responsive care. That is hope, that is momentum. And so I want to extend my heartfelt thanks to the Steve Fund leadership and board for their vision, to Lumina Foundation for helping make this convening possible, to our panelists for the generosity of their reflections, and to all of you, educators, students, advocates, for lending your time, your spirit, and your commitment to this evening. I invite each of you to leave tonight with one commitment, large or small, to shift your corner of this world toward equity and mental health. Share this research, challenge assumptions, build spaces of belonging, because the true measure of our institutions will not be in how many students we admit, but in how many we sustain, uplift, and empower. Thank you all so much for joining us this evening. Have a great evening. We appreciate you.